Not all palpable purpura is the same. I'm Dr. Neeraj, talking on differentiating purpura of a systemic cause from a skin-limited disease. Some cases are skin-limited, self-resolving, others are markers of systemic vasculitis. The challenge is identifying which is one, and that too early. Cutaneous vasculitis reflects small vessel inflammation, but the depth and the extent decide the severity. We'll just look at the features of benign skin-limited vasculitis. They are usually post-infectious or drug-related vasculitis. Clinical features, they have palpable purpura, their distribution is predominantly in the lower limb, systemic symptoms are absent, they never ulcerate, they never undergo necrosis, and it's self-limited and usually monophasic. Triggers, common is a recent infection, a drug exposure or recent vaccination. They often resolve once the trigger is removed. Now compare this with systemic vasculitis, which can also present with skin vasculitic lesions. The skin findings may be the first clue for deeper disease involvement. Systemic symptoms like fever, weight loss are usually present. Arthralgias are there. Some may present with mononeuritis multiplex. Sometimes hematuria might be there indicating renal involvement, or hemoptysis may be there indicating pulmonary involvement. Systemic symptoms change the equation. Now what are the skin clues to the severity of vasculitis? Ulcers are deeper, necrosis is severe, bullae show vessel destruction, and complex lesions suggest underlying systemic causes. The laboratory clues, ESR-CRP is elevated, urinalysis may show hematuria, and ANGA may be positive if it is an ANGA-associated vasculitis. So a normal lab will say that it is skin-limited disease or minimal disease. Skin biopsies help to classify it as leukocytoclastic vasculitis, which is often benign, to immune complex depression, which has systemic possible involvement. The depth of this involvement also matters. Time course, single episode, usually benign. Recurrent episodes or progressive systemic involvement, it is a systemic vasculitis. So how do you approach practically? Limited purpura, think benign. No systemic symptoms, think benign. Normal urine, think benign. Think systemic when multiple organs are involved at the same time or at different levels, different time, if the lesions are severe and recurrences. So skin vasculitis may be a local immune reaction, or it may be the skin manifestation of a systemic vascular inflammation.